I'm Phyllis Jackson. Welcome to StayAtHome Connect.
COVID-19 cases up now in 31 states. The COVID tracking project showing that the test positivity rates are up in 25 states. Georgia, among over a dozen states, holding steady. Doctors say there's growing evidence that COVID-19 could cause sudden hearing loss. A study published in the International Journal of Audiology reports that of the 138 COVID-19 patients reviewed, 13% reported a change in their hearing. Doctors believe the virus is known to cause blood clots in other areas of the body and think this could be happening in the very small blood vessels found in the inner ear. Other challenges included tinnitus, or ringing of the ears. The CDC now acknowledging that coronavirus is spread through viral particles in the air. The agency's website previously stated that the virus was mainly thought to be transmitted between people within 6 feet apart from each other and through respiratory droplets when an infected person talks, sneezes, or coughs. The updated version says it's commonly spread between people in close contact and spread through respiratory droplets produced when an infected person coughs, sneezes, sings, talks, or breathes. It also says infection can occur if those particles are inhaled into the nose, mouth, airways, and lungs. Local hospitals are gearing up for what could be a rough winter of COVID-19 and the flu. I recently spoke with Wellstar Infectious Disease Specialist Dr. Danny Branstetter.
Tell me what Wellstar is doing right now to prepare for, this onslaught of a potential twindemic. How are you guys preparing the public and preparing for what could be an increase in hospitalizations?
Yeah, great question. So much like our start in December of 2019, when we knew the coronavirus was happening over in China and Asia, we prepared. So we were thinking about what's possible this fall and making sure that we have necessary equipment, necessary supplies, training our personnel what to look for, and doing screening methods, asking the right questions. And then thinking about how do we expand our capabilities if needed. So it's all in preparation. Have a great emergency preparedness team in Wellstar. So it's been really good to see them in action, and kudos to them for all the work they've done. The second thing is we're preparing the community. So talking to people like you, Phyllis, who's getting the word out to help the community prepared for what they need to do to stay safe. And then we're making sure that people understand the importance of staying healthy. Going to your doctor, making sure your chronic diseases are managed well, your diabetes, your COPD, your heart failure. And then vaccinations, right? We know that they're helpful in influenza. So we are encouraging everyone to speak to their care provider about, do they need it and is it safe for them to get it? And if it is safe, then I would encourage everyone to get a flu vaccine. It's only going to be helpful in not only reducing the spread of influenza, but also just keeping you as healthy as possible. So if you happen to have any other complications this winter, it reduces the risk of you having a further added double, as you call, twindemics.
Atlanta City Councilmember Cleta Winslow honored as part of an Unsung Heroines mural. The event, held near the Goodwill thrift store on Ralph David Abernathy Boulevard, was part of this year's Elevate Art Festival. Councilmember Winslow says she's honored to be acknowledged.
These are people that have been committed to the West End and Westview communities, but even with that, they've been committed overall to the city of Atlanta in terms of making this city better.
That's a wrap. We'll see you on the next edition of StayAtHome Connect.